before the month of July 2014, when the Ebola virus disease emerged in Nigeria. It was looking as if the Nigerian health sector was headed again for another very bleak end, in 2014. Because before then, aside from the March 10, 2014 Abuja Presidential Summit Declaration or universal health coverage, there wasn't really much to talk about in terms of significant positive or progressive development in the health sector in 2014. So the emergence of Ebola seemed to have, provided us with an opportunity to, turn the tables. In other words, of course, it served as a turning point, in the hitherto bleak fortunes of the health sector as far as Nigeria is concerned. And so from then onwards, there have been some other developments, not minding the series of agitations and labor disputes that characterized the sector in 2014. There have been other significant developments, particularly the signing into law of the National Health Bill by President Goodluck Ebele Jonathan, GCFRO. That was a significant development in the health sector in 2014. And of course, subsequently, the long-awaited submission of the report of the Yahya Ahmed-led Presidential Committee of Experts on Interprofessional Relationship in the Public Health Sector in Nigeria. So these were some developments which hopefully will shape the year 2015. And hoping that, again, with some of the challenges of 2014 and even previous years addressed, particularly the issue of poor budgetary allocation to health, and of course the issue of poor political commitments at various levels of government, particularly the state and local government, that with the address of other human resource challenges, that made Nigeria in 2015, hopefully, with the implementation of the National Health Act, may witness some progressive developments. Let me say that in spite of what I have said so far, I must give credit to some agencies of government that have also, in spite of the limited resources available to them, tried to, of course, live up to their mandates, particularly the National Health Insurance Scheme. Seem to have revved the engine of growth, in the NHIS scheme. March 10, 2014, Abuja Summit Declaration of the President. There's been a lot of efforts put in by the management of that scheme to, of course, get more Nigerians enrolled in the scheme, and, of course, expand the base of health insurance through the launching of more community-based social health insurance scheme, the enrollment of school-age children in the program, and, of course, by ensuring that the National Health Insurance Commission bill is given some level of passage. So it's passed by the National Assembly, and we hope that it will be passed by the 7th National Assembly before they take their exit, so that it can be signed by Mr. President. So I would think that this, amongst some other developments, were remarkable in 2014, even though the aggregate performance, aggregate in the sense that not only do we expect performances at the federal level, but of course at the state and local government level, even though the aggregate performance is still not remarkable compared to where we are coming from in terms of 2013. So I expect that going forward in 2015, that there should be greater commitment of the political leadership, more so when elections are coming in 2015, that there should be some greater political commitment of the political leadership at all levels, federal, state, and local government, towards the health of Nigerians. And that is why I am saying, and I've said severally, that Nigerians, even in the coming elections, must put as priority questions on how the political leaders or the candidates are going to cater for their health. Because we need people in 2015 who can have greater political commitment to health, to put health as priority, not only in times of the Ebola crisis, but at all times, because health is key to development, to human capital development, and of course, to growing the economy. So I expect that in 2015, we will have greater political commitment to health. We'll have a situation whereby we'll have greater, in fact, accelerated implementation of the National Health Act in a way that will, of course, bring development to the health sector. I expect that in 2015, focus will now be placed on how to professionalize the Nigerian public health institutions. And that is why, again, that it is alluring, it is enthralling to note that the Yahya Ahmed Committee has submitted this report and hopefully should now clearly define some of the issues that have been agitating the minds of stakeholders with respect to health professionals in the health sector. And I think that they should be able to establish the clear leadership of the health sector as to who actually should lead the sector, so that you can do away with all these unnecessary beauty contests and agitations amongst professionals in the health sector. Some have said that this is the pathway, this is the international best practices. Some have said, no, this is how we can, of course, drive health system in our country. So I think the Yahya Lame Committee's recommendation should substantially shaping, the future and the destiny of the public health institutions in Nigeria in the coming year. And I hope that they have settled those issues of leadership, issues of who should head the institutions, issues of clinical governance in our institutions, issue of headship of the medical laboratories, and some other very, very critical, sensitive issues. So that is expected to drive, performance in the coming year, especially within the public health institutions in our country. Again, in 2015, I expect that if the 7th National Assembly is able to, of course, pass the National Health Insurance Commission bill, that substantially should help Nigeria in 2015 to give greater access to more Nigerians to be able to, of course, enroll in the National Health Insurance Scheme, with expectedly more state governments keying into the National Health Insurance Scheme. So if that happens, then we can begin to talk about a situation whereby you no longer have this whole incidence of people being unfortunately detained in hospitals, for instance, on account of not being able to pay their bills, due to the very, very high level of pauperization of the Nigerian people. But of course, now having a situation whereby you are paid for ahead of time, that is the whole beauty of the health insurance. So I expect that with the passage, hopefully, of the National Health Insurance Commission bill by the 7th National Assembly before they wind up, that we could have now a situation whereby universal health coverage in Nigeria will be shored up in 2015 from the abysmal 6%. And of course, like I said, with the implementation of National Health Act, that Nigerians should be able to now come out forcefully to demand for an expression of their health rights.
Let's cross over to the news segment. Liberians got a chance to interact better on December 31st, 2014, as authorities in the country lifted the curfew imposed to curb the spread of Ebola so that people could attend New Year's Eve church services. The United Nations Health Agency did not comment directly on the one-night suspension, but called for authorities to keep up social distancing measures and encourage people to avoid large gatherings. Liberia introduced the curfew last September at the height of an epidemic that has killed more than 3,400 people inside its borders and at least 4,400 more in Sierra Leone and Guinea. The virus, which causes vomiting, diarrhea and bleeding, is spread by contact with the bodily fluids of an infected person. Churches that held services observed measures to prevent the spread of Ebola, such as hand washing, temperature testing, and avoiding overcrowding. The midnight to 6 a.m. curfew was reimposed the following night. Meanwhile, Medicines Sans Frontiers, a medical charity that has been at the forefront in the fight against Ebola in West Africa, has warned of complacency in Liberia. The rate of new cases has slowed in Liberia, and health officials say the next phase of the fight against the virus will involve deploying teams of health workers to identify chains of infection. Moving on to the U.S., following a scientist's possible exposure to Ebola in a laboratory in the United States, the U.S. Center for Disease Control and Prevention plans to hire a chief of laboratory safety, a new post that has taken on more urgency. Creating a new high-level safety position was a key recommendation of a month-long internal investigation into the mishandling of anthrax and bird flu in CDC labs this past summer. Those incidents called into question safety practices at more than 1,000 laboratory and support facilities across the CDC's network of scientists. CDC spokeswoman Barbara Reynolds confirmed that a search for an agency-wide chief of laboratory science and safety was underway. Finally, the importation of live poultry from mainland China has been suspended for 21 days, starting from the last day in December 2014, after the H7 bird flu strain was discovered in a batch of live chicken from the southern province of Guangdong. Authorities also ordered the closure of the wholesale poultry markets where the virus was discovered for 21 days for cleaning and disinfection.
The fact that we are adding on different tests and safeguarding mechanisms in our live poultry supply chain, this particular measure has been effective in helping Hong Kong to prevent the risk of avian influenza affecting people of Hong Kong.
The chickens infected with the H7 avian flu were imported from a farm in Huzi City across the border from Hong Kong. The Agricultural, Fisheries and Conservation Department is calling all live poultry in the Shangshangwan wholesale market, which is assigned to keep only imported poultry.
The mass slaughter follows.
China has had a problem with bird flu for several years, and new infections tend to crop up in the winter months. The state news agency said 6 people in the eastern province of Zhejiang had contracted the H7N9 bird flu strain this winter, one of whom had died. Shanghai and southeastern province of Fujian have also reported cases. According to the World Health Organization, the H7N9 virus passes between birds, but there is not enough evidence to prove that it passes between humans. Just before we go, let's serve you nutrition tips on our Nutrition for You segment. Today we'll share with you the benefits of eating or taking as fruit juice watermelon. Watermelon, the fruit with a smooth, hard rind, usually green with dark green stripes or yellow spots on the outside, and a juicy, sweet interior flesh, usually deep red to pink, but sometimes orange, yellow or white with many or no seeds. Watermelons are mostly water, about 92%, but this fruit is soaked with nutrients. It has significant levels of vitamins A, B6 and C, lots of lycopene, antioxidants and amino acids. There's even a modest amount of potassium. These nutrients provide some of the first lines of defense that the body employs to keep free radicals in check and prevent them from causing damage on other cells. Aside from these, watermelon has a refreshing and sweet taste that could help combat the heat and also provide a guilt-free, low-maintenance dessert for kids and adults alike to enjoy. We value your contributions on Health News. Let's connect on Health News at channelstv.com, on Twitter at yourme_otaigbe, or send an SMS to 081-864-38129. Thank you for being a part of the show. I'm Yourme Otaigbe.